Well, hello, and welcome once again to the 21st Medical Group's monthly town hall. So this is our May rendition of our town hall meeting, and we have a little bit of new information for you, but a lot of updates to share for the month of May. Joining me today is Lieutenant Colonel Ben Berzinis, who is my deputy for the medical group and also the 21st Medical Group's chief nurse. Okay, for our first topic today, we want to give a little bit of a shout out to our nurses and medical technicians. Colonel Berzinis, would you share a little bit about Nurse Tech Week, please?
Absolutely, sir. So we're coming up on Nurse Tech Week, May 6th through the May 12th. Will be Nurse Tech Appreciation Week. It was first recognized by President Ronald Reagan in 1982 when he decided on 6 May to make that day National Nurses Day. 8 years later, the American Nurse Association in 1990 decided that one day wasn't enough, and we needed to celebrate that entire week. We also incorporate Florence Nightingale. She is considered the modern day founder of nursing, and so her birthday is on May 12th. So throughout the military as well as the civilian sector, they try to make sure to include 12 May as part of their week. The DHA, the Defense Health Agency, as it covers all MTFs throughout the Department of Defense, recognizes the contributions of nurses and techs, and they put out a message with the three words, unified, ready, and reliable. And that's what those three words that they wanted to use to describe the nurses and techs that serve within the DoD. When we look at unified, ready, and reliable, I would almost decide to switch those two words, at least the ready and reliable. And the reason why I would do that is because just like our FEMA team that was sent out, sir, we were unified as one unit coming out of the med group, but we were already ready. We were ready to go to answer the call. And so we had all the appropriate training. People were ready to go to battle against COVID. And so with a ready, united front, FEMA could reach out to us with a reliable resource in order to send our group down to Florida in order to help the civilian population there.
So thank you, Colonel Berzinis, for sharing a little bit of that background. And we would like to pass on our sincere thank you to all of our nurses and technicians as they continue to fight the good fight, certainly the fight that they've been engaging in over the course of the last year regarding the pandemic. Speaking of which, Colonel Berzinis, would you give a reminder to our viewers regarding what our nurses and techs and other personnel from the med group are currently doing with regard to fighting the pandemic?
Absolutely, sir. So a request came to us in February for approximately 50 or so people to support the FEMA mission and providing vaccines across America. And so we had approximately a third of our nurses, a third of our techs, as well as other AFSCs, other duties to go and to support the mission in Eastern Florida. And so with the training that they had and the ramp up prior to, they were ready to go, sir.
Excellent. Thank you so much. The next thing we would like to cover today is getting to your questions. Now, for this month, we only received one question, and it's specifically tied to the pandemic and our response to it. So we're happy to cover that. That's not a problem at all. But just as a reminder, we're willing to take any questions, whether it be COVID related, whether it's related to beneficiary services, healthcare, how do you access our care? Any question that you can think of that you'd like to put on the table, we'll take a look into and see if we can't get that addressed for you. So let me go over this month's question. With the governor's new edict on mask wear, how is that going to impact us here on our bases? Do we still have to wear our masks? The short answer is, for now, yes, we will still have to wear our masks. And here's why. So the governor of Colorado is making some changes to mask wear, although he did extend the mask wear policy for 30 additional days, as Colorado is really not doing as well as other areas of the country with regard to transmission rates, positivity rates, that sort of thing. Why are we not following the governor's guidance specifically on our installations? Well, frankly, it has to do with a matter of jurisdiction. On the federal installations, specifically on military installations, we fall under the guidance of the Secretary of Defense and, for here, the Secretary of the Air Force. The latest guidance we've received from the Secretary of Defense and the Secretary of the Air Force still has mask mandates in place for our facilities. Now, what we try to do is balance as much as we can our guidance on the installation with what's going on in our local community. So we do that as best we can, but we still have to fall under the overarching guidance that comes down to us from the higher levels. So we will keep our eyes and ears open in case the Secretary of Defense or the Secretary of the Air Force wants to lift some of those mask mandates and mask restrictions. In fact, there are many questions regarding mask wear as it relates to vaccination rates. So we are paying attention to new requirements and new policies every week to see what changes there might be. And as soon as we get any new information on mask wear mandates on military installations, we will be sure to pass that along. But again, the short answer is right now, Secretary of Defense and Secretary of the Air Force policies does still have a mask mandate in place for on our military installations. The next topic we would like to address is to offer an update as we continue to roll out our new electronic health record system, MHS Genesis. For more information on that, I'm going to pass it back to Lieutenant Colonel Berzinis. Ben?
Yep, thank you, sir. So the MHS Genesis electronic medical record, I think you briefed last town hall that it was on its way. Well, it has arrived. We, on 24 April, had a validation Saturday where about approximately 10% of our med group came in to make sure that the hardware was working, to make sure that people were able to log on, and really to kind of calm the herd, so to speak, before the wave truly hit on Monday. So it was kind of like a wading into the water period. And so we waded in on Saturday, and then we dove in on Monday. So we are in full swing with MHS Genesis. We're about a week and a half into it. Things are going extremely well. This MHS Genesis rollout just didn't happen just to Peterson, Schriever. It happened across our market with our sister service Fort Carson, as well as USAFA. And quite honestly, sir, it extended out to 25 other MTFs across the United States, as far as south as Fort Huachuca in Arizona, east to Offutt, as well as up to Minot, North Dakota. So it has a vast expanse. So what's the so what behind this Genesis? So what it does for us, for military providers and nurses and techs, it takes 3 to 4 legacy systems that quite honestly have been around for decades, and they incorporate into one electronic medical record. By doing so, we streamline our processes, we streamline how much information that we get, and quite honestly, it's a better patient experience for us as healthcare providers. But more importantly, what it does for you, for the public, it provides you a way in order to view your entire health record. You can see when your visits were, you can see when your labs were drawn, you can see those results. You can see your radiology studies, your x-rays, and so forth. And so it provides a wide gamut of information for you as you access what is now the MHS Genesis patient portal. With that portal, you will, besides for viewing your health record, you'll be able to message your primary and your special care providers. You'll be able to request prescription refills. And very soon, I would imagine by the end of this month, we'll be able to start scheduling appointments. You, as the patient, be able to start scheduling appointments through this MHS Genesis patient portal. This trifold that I held up, this is available here at Peterson, and it is at Schriever. And so we do have handouts here, as well as I know there is a PA article that got posted with a website that you can click on to as well. And so we are trying to push the message out that this is the new electronic medical record that we're providing for you. So what happens to TRICARE? What happens to TRICARE Online is typically one of the questions we get, and that system is going away. So we would recommend and encourage you not to utilize that portal. If you click on it, as of right now, there's a banner that goes across the top of the screen that says that as of 16 April, the appointments are turned off, and on the 23rd of April, messaging was turned off. So I say all that to you so that you don't get frustrated as far as, well, what's going on with TRICARE? What's the same, right? So what can you truly rely on as we transition through this? You can rely on the PASS, right? The phone number that you can call. It's 719-524-2273. And that number has not changed. And so to make an appointment for your primary care provider as well as refill prescriptions, continue utilizing that phone number, because that will provide you with the care that you need. The second thing is the nurse advice line has not gone away either. So if you have a question, if you're wondering, should you seek additional medical care, that is available to you at all times as well. So what's different is the MHS Genesis portal. What's the same is you still have the PASS, you still have the Now, and what's different, the TRICARE portal has gone away. So bear with us, have patience as we meander through this. But when we come out the other side, this will be a huge win for our patients as well as for our med group providers here.
Now, I would like to follow on to some of what Lieutenant Colonel Berzinis has said regarding MHS Genesis, to offer some status updates regarding our military treatment facility and what we're facing right now. So as you might imagine, replacing 4 different legacy systems with one central system is going to take us a while to, 1, get the system up and working, and 2, to learn how to work the system ourselves, not to mention offering that information to you all to be able to interact better with the MTF. That's going to take some time. In addition, we've already mentioned our FEMA team that is out providing support to the Vaccinate America program. In addition, we still have our own vaccination ops going on at Peterson, Schriever, and Cheyenne Mountain as well. With all those things happening at the same time, we understand the frustrations that come with a lack of access to care. And what we mean by that is we understand that if you call the central appointing line, you might either be offered an appointment that is further down the road than you would prefer, you might be deferred off base for some of your care. So it's just going to be a little bit more difficult for the time being to get in to see us, and we understand that. However, last week into this week should be our lowest points with regard to access to care. Our plan, as we learn this system and continue to develop it, is that access to care will improve over the course of the next several weeks and certainly into the next several months. So that's our goal, but I just wanted to offer that reminder that we are in what I would consider a bathtub right now with regard to access to care. So there is certainly a dip, and we understand the frustration. And to echo Lieutenant Colonel Berzinis' point, we appreciate the patience as we work through this process. On a final note, I wanted to offer an update regarding vaccination and vaccination status. The simple fact at this point in time is this: we are to that point in time where we actually have better supply than the demand for that supply. As recently as a month, maybe month and a half ago, we still had folks who really wanted the vaccines, but we simply didn't have the supply to get it to them. We're past that now. So I just want to echo previous advertisements that if people want the vaccines, they can get it through us. So it is available. In fact, we have the COVAX link for people to be able to schedule their own vaccines that we've published in the past that will make sure that we publish that again. So if you want the vaccine, you're welcome to come to us to get it. So once again, thank you so much for joining us for this month's rendition of the 21st Medical Group's Town Hall. On behalf of Lieutenant Colonel Ben Berzinis and me, Colonel Patrick Pohle, we thank you for your time and your attention. And remember, please, if you have any questions at all that you'd like for us to address going forward, we'd be happy to do so. Doesn't have to be COVID related, could simply be any topic that you want addressed out of the medical group. Thank you for your time and attention.